we're here with Leah. She's now 1.5 months out of her breast augmentation. This is silicone breast implants that are placed under the muscle, and she is very happy, and her implants have now actually come down where they're supposed to be. And you can see where the implant is delineated. The lower part of the implant is sitting right at the fold, and the upper part of the implant is sitting. We would like it to be just so lightly lower, and that's a more natural look, and with time that will come. But right now, we're very happy with the positioning of the implant and with the shape of the implant. She's very happy with the results. And now we want to just quickly go over her initial few days of experience, because it's important in preparing for surgery not to think that the surgery is just something that you do and it has no pain and there's no issues. There's always surgery is a real decision. It's an important decision. I don't look at it as a weekend deal or a lunchtime event that you do, a little spa issue. This is surgery, and we dissect under the muscle, we release the muscle, and when somebody like Leah, who works out all the time, we have to release her muscle, she's going to have a little bit more tenderness and pain after surgery. But somebody who's lighter, or somebody who's placing the implant under the tissue itself, they're not going to have as much pain. Leah, tell me a little bit about your first few days. I know in the spirit of being transparent with our patients, yes, we want to know sort of like how much pain medications you took, and how did you control the pain, and how many days did that window last that was difficult for you?
Yeah, of course. So the first few days are difficult, especially the first two. Once you know the medication and the anesthesia passes over, you start to feel everything. But of course, taking those medications every 6 hours, the way it is prescribed, it is manageable. After the first 5 days, you start to feel a lot more able to do your normal abilities, such as getting up, because getting up will be hard, and even going to the restroom. So having someone to help you out during those times, it makes everything a lot more manageable.
Okay. Now, tell me, when were you able to start driving, and when were you able to go to work? Sort of, you have a desk job,
yes,
if I remember correctly. So tell us a little bit about that.
Yeah, of course. So I work in the gym industry, so technically speaking, we're not even open. So that was great for me in terms of timing. But driving wise, maybe I want to say a week and a half. As soon as I stopped taking my narcotics and medications were done, I started driving. I wanted to drive a lot earlier. But of course, Dr. Moein suggested wait until you're done with the medications. That way you're driving a lot much just better. So I started driving a week and a half after, and as a matter of fact, it's been, I want to say, a week so far, but I've been able to jog. I've been able to start to exercise a lot more like myself, like I used to, and you just start to feel so much more normal as time goes by.
Okay. Now, are you happy with the size of your breast? Do you feel like these are appropriate size for your body?
Absolutely, yes. I initially wanted something much smaller, but then after various, trying on and seeing how it feels, how it looks, I'm in love with this size. I feel this is perfect for me. Plus, I do work out, so I didn't want something so big that would not allow me to work out as much as I used to, because of the heaviness of them. This, for me, is perfect.
Yeah, it's the process of sizing is really important. The consultation for breast augmentation is something that is often underestimated, and I feel like especially when people have secondary staff during the consultation, they may miss the essence of the consultation process, both from a medical standpoint and from choosing the correct size. And what I'm referring to most importantly is being able to really get into and understand your patient. As much sizing is about the body frame and how somebody's body looks, it also has to do with somebody's personality. You want to make sure that your patient's personality fits the size of breast that you're recommending to them. And when you have a shy patient and you underestimate how they feel, and you put a large implant, they're not going to be happy, even if it fits their body. You got to be able to get into that level with the patient and be able to understand their concerns, their overall personality, and how they would be in public and how they would like to be perceived, and that helps a lot with coming up with the correct size. Like with Leah, I even discussed it with her, and I wanted to understand when you walk into the room, how do you like to be perceived? Are you the light of the room, or you're a more shy person? And we really need to get that information out, as much as understanding what size her base width or her chest plate is, in order to be able to place an implant. So that's part of the process. And then we had a long discussion regarding the silicone saline differences, and in the silicone department, what type of silicone we're going to use. And then the process of coming up with the correct incision. We have 3 different incision options for our patients. There's an incision underneath the fold, which is, as you can see, extremely well tolerated and hard to see. You can lift her breast, and it's hard to even see where the incision is at this point. And then there is another option that we can go through the axilla, through the armpit, and place the implant underneath. And the last option is going around the nipple areola complex and placement from that angle. Each one of these options have some pros and some cons, and you have to really sit down and explain that to your patient in order to be able to provide a very effective and transparent conversation with the patient in terms of understanding and making sure that they're making the right decision. Anyways, thank you for joining us. Thank you for taking that time, and it's been lovely to take care of you.
Thank you,
and
Doctor.
thank you for joining us.